That starts. Welcome. We're really excited to have our nursing panel of IHeLp alumni join us. Uh, we're going to go ahead and highlight the folks on the panel, and we'll get started. We wanted to get started right away, even though we know some more people will be joining us over the next few minutes as they get off of work and can pop on. Let me see if I remember. Let's see, spotlighting. And the spotlight, one more. All right, and I will go ahead and add myself since I'll be doing some talking here. I'm Molly Burke. I'm a Director of Online Education here at the Andrew Weil Center for Integrative Medicine, and I also direct our Integrative Health and Lifestyle program here, and very excited to have invited 3 of our recent graduates from our IHeLp 2024 class, representing quite the large number of nurses that have been in our IHeLp program since our inception in 2014. We actually have had over 200 nursing and nurse practitioner graduates of the slightly over 400 alumni. So we have Omira, Namisha, and Olivia here, and I'm gonna try to do very little talking and just facilitate some of the questions. And then please, if you do have questions for them during this part of the Q&A, go ahead and pop it in the chat or just write it down. We will hold about 15 minutes at the end for sure to get any of your questions answered. And if you have questions about the program, logistical questions, then Leah from admissions, who's here, can answer that in chat as well. All right. First question, I want to start with Namisha. That's all right. I just wanted to have you tell us a little bit about yourself. You can say where you are from, a little bit about your professional background, and what you're doing right now.
Sure. My name is Namisha. I live in the Bay Area, in the East Bay, specifically in California. I've worked with the same hospital for almost 20 years. And I've jumped around in different departments, but for the last 13 or 14 years, I've been in cardiac case management for cardiac surgery patients. We do all of the pre-op workup and get patients ready for surgery, and been doing that a long time. Recently, I would say maybe like 6 months ago, I kind of dialed back my hours to per diem, and it was kind of nice when I did the program, so it gave me a little bit more flexibility in time. And so right now I have 2 kids at home, teenagers, so it's been nice to cut back hours and spend more time with them and work when I want to work. But eventually I would love to continue on this path of integrative medicine and do something in coaching or, somewhere in that field.
Great. Thank you and welcome.
Thank you.
Omira, tell us about yourself.
Hi, everyone. Um, I live in Austin, Texas, and I have been a nurse for about 10 years. Prior to nursing, I worked in the mental health field. My first career is actually in mental health, and I became familiar with the IHeLp program when I was at the University of Arizona getting my psychology degree. I I
Sorry, trying to get some people muted. I think we're good.
Okay. Um, in the last 10 years, most of my experience has been in maternal child, public health, and also lactation. I've worked in the ICU for like a hot minute, and I've worked in community care-like settings, school nursing, just various clinics, uh, but most of my experience, I would say, is in like the postpartum period. Um, as far as what I'm doing specifically right now, I'm doing postpartum home visits for families 2 to 3 weeks after they've given birth. We do a check-in on mom and dad and their partners, and we make sure that they're doing all right clinically, emotionally, that socially they have all the things that they need. We check in on them, especially mental health wise. We do like a depression screener. We check in on babies, do a lot of lactation, do a lot of connection to resources. And it's nice because it really allows you to kind of practice holistically. And that's one of the things I've loved about incorporating um, the IHeLp program with it. It's given me a little bit more confidence. I have a little boy and had a cat that just recently passed away. Had him for almost 18 years. I love the outdoors. I could basically, I think if I didn't do nursing, I should have been a park ranger because I could be outside all day. Um, and that's that.
Great. Thank you so much. Olivia.
Hello, everyone. I'm Olivia Teixeira. I'm from the Bay Area in California, from a city called San Jose or Santa Clara as well. I'm an RN. I've been a nurse for 13 years. I did ICU, especially cardiac ICU, for about 7.5 years. Then I transitioned to work in prepping patients and recovering them from cath lab procedures. And then now I do just everything under the sun for pre-op and post-op nursing care. And I'm a charge nurse on the unit and also work in our hospital shared leadership as the chair. I'm at a large teaching facility here in the Bay Area. And um, yeah, I love the IHeLp program. So I can't wait to speak about it a little bit more.
Thank you so much. Thank you all for being here. Olivia, I'm going to stick with you for this next question. What are some benefits for nurses who would graduate from the IHeLp program?
Yeah, there are many. One of the biggest ones would be the ability to become a health coach after. You become eligible after a 6-month program to go and do a health coach program. And they have one also at the University of Arizona. You can incorporate a lot of what you've learned, not only in your life, but into your family, loved ones, friends' lives, and bring it back to, where you work. For my job, we've been working on some aromatherapy, nausea interventions. And it's nice to have all that background knowledge and, because a lot of people in my job kind of have very much a Western medicine thought process, and I'm able to speak on so much more than pretty much most people I work with and have the tools to access, research about it, my experience through the IHeLp program, our amazing retreat, and making essential oils and talking with the different instructors on the benefits for different things. So yeah, you can kind of go wherever you want with it, or if you're already advanced care provider, like a nurse practitioner, you can go forward and do a fellowship, which is also another great option. So a lot of benefits there.
Thanks. Namisha, what are some benefits that you've seen for RNs in the IHeLp program?
I just feel like it gives you more in your tool belt, right? Like you go to nursing school and a lot of it is the Western medicine practice of you have this diagnosis and this is how you treat it. And it continues that way, right? For every single thing that you learn. And this just gives you a little bit more tools that are, more on the naturopathic or holistic side of things. And things you can do at the bedside, or a lot of my work is over the phone, and things I can like help patients with over the phone that are not always, giving a pill for something or something like that. And things that patients can practice at home that doesn't cost any money, or, things that they can incorporate into their daily life, which is really nice. So I just love that. you have more tools in your pocket that you can use now after this program.
Myra, your thoughts?
For me, one of the things that the IHeLp program helped me with is just getting more confident. And when I talk about integrative health, um, I feel like there's so much hunger for wanting to know more, not only from a lot of nurses, but from patients. Time and time again, when I'm in home visits, people always ask, is there a more natural way to go about this? What can I supplement with? What are some other treatments that I can use they're a little bit more holistic? And I come from a culture where we practice a lot of the stuff that I learned in IHeLp, but IHeLp just allowed me to gain more confidence in that when I go out and I talk with other providers, because we know as nurses we're oftentimes the middle person, and so people want to know, where's the data, where's the evidence behind this, and so I can reflect back to the coursework and pull up that evidence-based research on whether it's a supplement, whether it's aromatherapy or meditation. And so that has it's the confidence that I gained, um, and then just to normalize it as well. Everybody wants to know more, but they just don't know where to begin.
Great. Has the motivational interviewing training that you received in iHeLp, has that been something that you guys have felt you could utilize within your different practices? Just jump in. I'm sorry, I'm making it organic now.
I
I
definitely think so. Oh, go ahead, Omira.
no, go on, Namisha.
I definitely think so. It really changes your shift on how you would approach a patient or how you would ask a question or learning how to rephrase how you would talk to a patient. It really kind of changes how you think about things. And I feel like now, before you ask a question, a yes or no question or whatever have you, you really think about how you're going to phrase it and how you're going to talk to the patients.
Yeah, exactly. It's a type of interviewing that you kind of get behind someone's reason for wanting to do something, so it in turn motivates them to accomplish that. And you practice it a pretty good amount in our program. And I kind of did find that when, I'm asking people certain things, or they're like, oh, but I couldn't do this or I couldn't do that. Instead of being like, oh, that's too bad, just being like, really? And, kind of asking in a different way that makes them ponder differently. And it's almost like kind of like a psychology class, but it really helps get patients to see what it is they want without being more, direct with it.
Yes, I completely agree with both Namisha and Olivia. I think also it helps you to be more mindful in by just, practicing that motivational interviewing and really trying to understand where your clients are coming from allows you to kind of take a step back and try to digest their story and kind of go in your toolkit and see, okay, what can I pull out that could potentially help this client?
Thanks. I feel like with nurses, even though you are all so overworked and could use more time with patients, I feel like you have more um, interaction and time to talk. And the one thing with integrative health is so important to have those conversations, to really listen to what the patient's saying. And like you're saying, Omira, what can I, after I hear that, what can I offer? That would be beneficial. I'm going to stick with you, Amira. What are a couple of aspects of iHeLp that were most meaningful or impactful to you?
Yeah. Um, I loved learning about the 7 core areas of health. I thought that was just amazing. I mean, I grew up again with my mom and my aunt and my grandparents talking about it here and there. Um, but just like really reflecting on how everything is so connected. Um, and then also the mindfulness and breath work. For me, mindfulness and breath work were, especially the breath work and the retreat that we did. Um, that was amazing. I love that. I still practice a lot of that breath work, and it's just, I love that. I wanted more of that.
Mm. Olivia?
Yeah, I'd also agree with Elmira. The 7 core areas are a large part of the program. And then even within those 7 core areas, it's sleep, resilience, movement, relationships, nutrition, spirituality, and environment. Um, Things like learning more about sleep. And something that really stuck with me is sleeping enough to dream. I think it's not often enough that we get enough sleep, that we often don't remember our dreams, but just to know that we had dreams meant we were sleeping pretty good. And then movement, learning about something like a weekend warrior, where you don't have the time during the week to do the exercise, but maybe you do a lot over the weekend, and that's okay too. Or just being active means taking the stairs as opposed to the elevator, and parking further away from the grocery store and having a longer walk with your shopping cart. Little things like that we should give ourselves credit for doing, and instead of just discounting, oh, I didn't exercise, I'm still going to park close to the store and just blow it all together. No, there are ways to still be active and make healthy choices with little mundane things we do every day. And that's why this is a lifestyle class. And I really liked the environment piece too. I think we talked about like having greenery around you. And I've kind of touched on looking into this concept of hygge, which is like a Danish concept of having more wood around you and how much your environment affects your overall well-being. And coming home from a stressful job and just seeing things that are stimuli that are positive for you when you have so much craziness going on in the world, and little things within those 7 core areas that you can change or do for another person who's going through a tough time, that are inexpensive, they're easily accessed, and they can make a world of difference. So having access to this valuable information that has background behind it is super meaningful.
Thank you. Amisha?
The part of the course that I would say was the most impactful was our retreat. It was just such a great experience, and meeting like-minded people and talking about, what we do, where we come from, what our beliefs are. And a lot of it were very similar. So it was really fun. And just doing all these things that, like you hear about, like, let's say you heard of essential oils, but you've never actually used them or played with them or whatever, and actually getting to make different blends and use them and see how they work, and putting all of the stuff that you're reading to use was the best part, and the cooking demonstrations and all of it. And we did one section on the guided imagery where we were given a sheet and we had to read it to each other. It's just nice because I feel like you'd never really get to do something like that. Like, it'd be nice to be the person guiding in, a meditation, but if you've never done it, and we got to actually put all of that into practice, which I thought was really meaningful.
Yeah, it's not just theoretical. That like,
Exactly.
hey, we can play with these things are real. And then what we hope, build your confidence so you can try to use it with your patients for sure. So the last question, how are you incorporating what you've learned from IHeLp into your professional life? I'll start with Olivia.
Yeah, so like we just talked about the 7 core areas, you learned so much about ways to change your lifestyle, to bring positivity in, and to bring different wonderful integrative interventions into your life. A few things is, I've told my family and friends, I've changed some of my own environment. I've spoken with my patients that are maybe going through something, and I could tell them a little bit about what I've learned. And they just love hearing these things, because these are things their doctors or nurse practitioners don't have time to go over with them, or haven't had the opportunity to, and they want more of it. Andrew Weil has said this is like the future of medicine, and I I really do think that is the case. But I've had a few friends that are going through chemotherapy, unfortunately, but I kind of put together 2 care packages for them with different things we've learned from the program. Like Namisha said, at the retreat, we were doing stuff with cooking and learning about ginger and essential oils, and all of these things can go make a great care package. So I've done that for a couple people I know. Like I said earlier, our hospital, we're working on ways to minimize nausea and recovery unit. So implementing what we've learned there, like deep breathing techniques, anxiety, and all that stuff. So plenty, and I'm sure more to come.
Great to hear it. Namisha?
So one of the things I feel like we forget about is to take care of ourselves. So we've implemented this wellness at work with our employees. So we do, like wellness walks or like stretches, things like that, whatever wellness kinds of things we can do together. But not only that, like I mentioned earlier about having the tools and having the research now to talk to our patients, a lot of for me, the surgery patients have to lose weight before they have surgery, or they need to lower their blood sugars, things like that. So now we have so many more things we can talk to them about rather than just the regular Western medicine approaches. And especially like people have a lot of anxiety pre-surgery. So we do a lot of the, giving them websites or information on guided imagery and all of that. So just have a lot more that we can give to patients now after the course.
Awesome. Thanks. Well, Myra?
So, one of the things professionally, of course, is just implementing what we learned with my clients. And but outside of doing that, I think for me as a professional, it gave me the confidence to actually open up my business at the end of June. It was something that I had wanted to do for a long time, but I was like, I don't know, I don't think I'm ready. I feel like I need to learn more. And it's a lactation and an integrative health business, and I'm hoping to eventually incorporate health coaching into it. But I don't know if I would have, really committed to that if I hadn't finish this program. I just think it gave me more confidence. And as I haven't, the business hasn't been fully launched yet, but as I've implemented, for example, the 7 core areas of health with my clients and seen how like there's such a big market out there for it and so many people want to learn more about it, it's just given me more, it's just like it's ignited a fire in me and a drive that, okay, I want to do more of this and people are asking for this. So professionally, I think for me in that regard, it has helped me to kind of look at other areas that are not really talked about much, especially in the nursing field, because it's very much like there's only these certain professions you can do. And if you navigate a little bit outside of that, is it really nursing? Then you go through this program and you're like, absolutely, because, by nature, I think working, with many healthcare providers, but especially within nursing, it is already so integrative and holistic. We are already in some way subconsciously assessing their sleep and their nutrition and their diet. But um, the program just allows me to kind of really like tap into that and talk a little bit more about that. So professionally, both utilizing it for my clients and then for my business, it's been great.
That's really exciting to hear. Thanks for
Yeah.
sharing about that. So that's the end of my questions. I could go on because there's plenty more to talk about with like how the self-care assignments and teams, how they impacted you. But I do have a short slide deck I could go through. But what I want to do right away is make sure if there's any questions. I didn't see anything popping up in the chat. But if folks have any questions for our alumni, I'd love to. Depends on how savvy you are with Zoom. I'm going to go ahead and take all of our spotlights off. So if it's easier for you to just go ahead and raise your hand with your camera on so we can see you, because you're not sure how to use the Zoom hand. All right, get mine out of here. All right, now we're all in a group together. Gail, I see your hand up. Go ahead and unmute and let us hear your question.
Oops.
There you go.
So, yeah. So I've been interested in this integrative mode of looking at health and well-being for a really long time. I was licensed as a marriage family therapist in California in 1988 and have my doctorate in psychology. Before that, I did body work, massage therapy, studied Lomi body work, and before that, I had done some dancing myself. So I've always been interested in the health field in general. My mother and her two sisters were nurses. So I was drawn to the field, but not from the Western medical approach. And I left the field. I took a detour. Well, I stayed active in terms of my license, and I volunteered with hospice, doing bereavement counseling in my community. But I took a detour as a single mom and practiced real estate, commercial real estate, because I just didn't have what it took to give. So thanks to the pandemic, I got back into therapy with teletherapy, and I love it. And then I tried to move. I'm in North Carolina, where the Helene hurricane hit, by the way. I tried to return to California because I had had such a great career there, and it was very stimulating. And an old friend of mine said, well, join our group. And I did. And I loved the clinical aspect, but I hated, it was a managed care. I just hated it because there was too much, some of the tests are good, but it was too much emphasis on pathology, on identifying, diagnosing, symptom management, and get them in, get them out, alleviate the symptoms. And it just wasn't satisfying. So I gave notice, I resigned. And I'm looking to this program. I think it sounds like it would be really good for me to kind of synthesize, like remember to bring back what I used to like and do, like guided imagery, for example, and then synthesize it and then integrate it into probably a private practice. Whether I want to go into coaching, I don't know. Which isn't to say it's not valuable, but I'm already licensed to practice therapy. So I don't know about that yet.
Sure. So one thing I wanted to, let everyone know, because I know not everyone joining is a nurse, is that the Integrative Health and Lifestyle program is interprofessional. We have over 30 professions represented in our alumni. Nurses are our strongest representation, but we can definitely have admissions connect you, Gail, with some of our folks who are therapists, licensed clinical social workers, LPCs. We have a wide variety of folks who come from mental health behavioral field who could talk to you about, how are they able to now practice from their passion within their scope of practice. And on the second part, I just want to say, like, for coaching, just so everyone knows, this coaching class that just started is going to be our last coaching in this design, and we're taking a pause in 2025. to reevaluate. There are lots and lots of coaching training programs out there. And so we're looking into what would we need to do to maintain a robust coaching program, but also one that's competitive, just because unfortunately the market's flooded. But we have other coaching programs that we admire and we would recommend.
Mhm.
And possibly in 2026 we'll have a re-delivery of our coaching. But I hear you. We've had a number of mental health professionals who have done the coaching because it's such a different approach than what is trained. But as far as scope of practice,
Right.
yeah, it's just a different field. But if anybody wants to experience the type of coaching that we train, our students do free coaching hours. So we have like 22 students in this class. And so just let admissions know and we can connect you with them
Okay.
for free health coaching experience when they're ready in about 2.5 months, I think.
I'd also like to say one more thing. I'm really doing this also for myself, for my health and well-being. My mother died last year, and it was a profound life change for me. It really, made me, I feel like it changed my identity actually, and made me question, well, how do I want to spend my time? Because it is limited. Yeah. And I'm also at a stage in life where, you know, I have high blood pressure. Well, that's normal at your age. Well, I get that kind of stuff. And it's like, I want to protest that. And so I'm really interested in improving my own health. I'm interested in growth and thriving, not just like saying, well, okay, this is how it has to be.
Yeah. I would say that our program, there's huge emphasis both on the concept of spirituality and healthcare, but under, one of the elements under that is meaning and purpose. And how can we make sure we're always staying connected to our own meaning and purpose? And then, as I alluded to, the self-care practices.
Mhm.
Self-care is a key part of the design from the beginning. And folks do things like learn about sleep and health and then have to assess their own satisfaction with their sleep and then think of ways that they would implement self-care to improve that area. And then in small faculty mentored self-care teams, they report back on their experience and support one another throughout that. And so
Yeah.
I think Omira and Olivia both mentioned the 7 core areas of health, and each self-care assignment relates to each of those 7 core areas. And you get to see firsthand just how interdependent those core areas are and what amazing positive impact you can have making one small change
Mhm.
across your overall health. So thank you so much for sharing your story. Yeah, it certainly resonates, and we can connect you definitely with alumni. Olivia, you had something?
Yeah, I was gonna say thank you, Gail, for sharing your story with us. And I think the retreat is wonderful. I cannot say enough how much we all enjoyed our retreat. It's a week, and you get to go there on the beautiful brand new campus. The food's amazing. It's so nice to finally meet people in person. But everyone in this program, for the most part, was having an aha moment in their career, in their life for one reason or another. And it's kind of what brought us all there. And it's something we could all relate to, whether it's their own health or something in their family or their job. And they feel like they're just seeing patient after patient. It's a numbers thing. So you would be in great company with this program. It truly is a whole bunch of people. And you're learning throughout the program and having those aha moments pretty regularly when you do your coursework. So I just heard you saying that. I'm like, oh, that was definitely something we hear a lot in this program and we heard at the retreat. So that's the kind of colleagues you'd be working with.
Thanks, Olivia. There were some questions in the chat. There's a question Elizabeth says, I'm not sure this is for the alumni or tactical. Does IHeLp program provide nurses with CE and supervised coaching hours required for AH and CC requirements for testing? So our program is approved for the AHN and CC Holistic Nurse Board Certification Exam. There are not supervised hours required. It's the number of continuing nursing education credits. It's 48, I believe. And we have right now we have over 60 CME and CNE offered, both from the online curriculum in the program and the 4-day retreat that folks were talking about. So you have more than enough, and that organization recognizes that everything we teach is in parallel to a holistic nursing perspective. And so we're approved as long as you apply within 2 years of graduating, because of we don't want the CE to be expired once you get those numbers. And I think the supervised coaching hours may be more related to nurse coaching, which is a different certification.
Thank you for clarifying that.
Totally.
It's kind of mystical, especially when you're looking at health coaching programs too. It gets really blurry. So thanks, Molly. I appreciate
No
that.
problem. Because we actually know some of our faculty in the health coaching program do those supervised coaching hours, and they also teach for us. And they're like, I tell people they should go to a program and get their supervised hours that way versus this route that the group has allowed, which is like to find a coaching, a nurse coach, and have them supervise you for a bunch of hours and paying them directly. She's like, it's just a more robust experience to be in a coaching program.
Thank you.
If that's interested to you. Yes, no problem. Let's see. So, and Tammy, what time did you commit weekly? And do you have any suggestions about this? And that's a great question, right? Because almost all our students, they're usually full-time. Sometimes they have cut back their hours or have flexible hours, but it's still a lot of time to commit every week. And you need to stay on pace. And you guys can speak to this, but we're always saying you've got to stay on pace with your peers and be learning at the same time and doing the work together. Does anybody want to start with thoughts on that, Olivia?
Yeah, I was gonna say, I would say it's about 10 hours per week, and you can see the modules are arranged. It's kind of one topic per week, and you'll get the syllabus at the beginning of the course, and you can kind of map out your next 6 months ahead of time if you'd like to, if you have vacation coming up or whatnot. But it'll tell you how long each module is. So you can break it out per day or a whole bunch in a day and a whole bunch on another day, depending on how your schedule works. But it's crazy because, you know, when you do your coursework in college or wherever else, you have to do it to graduate. And, you know, the nursing stuff was probably pretty interesting, but this is like everything is super interesting. People are wanting to read more and click extra links. So you can go down a rabbit hole of all these wonderful things because it's something you're here and you're doing because you're passionate about it. But on average, I'd say 10 hours a week, and it's really nice how everything's arranged. So you can organize according to how your schedule works out.
Great. Thank you. Namisha?
Yeah, I was just going to say the modules even kind of give you how long each section is in terms of this will take you an hour to do, this will take you a half hour to do. So you can kind of plan it out. But I would say it's probably like about 8 to 10 hours a week on average.
There's a lot of reading, but it's very interesting. So just to be transparent about that, it is pretty heavy on reading. However, with what Olivia had said, you can totally go on a rabbit hole. There's so many links and videos. We also have the self-care projects that you do. I believe it was with every few weeks. I forget. But and that was it's nice because you're essentially incorporating what you're learning to yourself and even your family. And then you have we would have like talks based off of certain modules, and those were really nice. You get to ask the experts questions, um, and then you have a capstone at the end of the semester. Um, but they walk you through all of that, and then you have a mentor that you meet with. I think it was every other month, and you can get some guidance from them as well.
Yeah. And a couple things come up for me with that. Folks who do like to go down the rabbit holes, right? Like, so all our evidence based content, we're having citations that are linked to PubMed to support, here's the evidence that supports this approach. And you don't get full library access. So it's like the abstract that's available unless it's a free article. But some people they're like, I want to read the full, read the full abstract, find the article, read it. And we'll always say, hey, if time is of the essence, get through your coursework, because you have, first of all, at the end of that 6-month program, you have 60 additional days of access to that class. And then graduates become alumni, and alumni have the ability to join premium alumni. So for a very nominal annual fee, you get access to the latest version of the IHeLp curriculum, and it's like all searchable. So if you're like, I want to go back and find that section on vitamin D, you're going to get the latest information on vitamin D. So I don't discourage you spending 20 hours a week if you want, but if you don't have 20 hours a week, do the work and know that you can come back. It doesn't disappear when you mark it complete. So I think those are just a couple of the points that I wanted to make. But Omira, thank you for bringing up all those things. Also, you brought up our integrative health healing talks, which were new, which we had our faculty come for an hour a few times throughout, I think about 6 or 7 times throughout the program, talk about a topic that was related to online coursework, and then answer questions for students. And it was just nice to even though, yes, we didn't meet in person until the retreat, that we got to spend time together. We spend time at the welcome, where we kind of orient all the students and get them to know each other at the start of the program. And then we have these touch points, and then you have touch points with your self-care team and your faculty mentor. And then we have the retreat, and then we have graduation. So I do appreciate the silver lining of the pandemic brought comfort for use of virtual connection, because we really love that we can reach so many people across the country and across the world. We've had people from a number of different countries who have joined the program. All right, so many more questions. Let's see. For an RN, you require one to have a BSN for the program. I have associates and a bachelor's degree in psychology. No, if you have a bachelor's degree, that's it. You can apply, no problem. If you have an associate's degree for nursing, then we require that you be in practice at least 10 years. So associates plus 10 years equivalency. And because you already have a bachelor's degree in psychology, that you already meet the bachelor's minimum, plus you have a license. So an active license in your healthcare profession is required. Exceptions can be made if you can request exceptions. So someone wanted to know about nurse practitioners. So today we focused on our RNs. We also have a great group of alumni who are nurse practitioners. They are, I think we have had over 50 nurse practitioners graduate from IHeLp, and we actually didn't open up the program to nurse practitioners, physician assistants, and PharmDs until I think 2017. We expanded it because we have our fellowship program as a 2-year, mostly online program for clinicians and prescribers. And we just recognized that for some, that deep 2-year clinical dive was just not what they wanted. and what we're looking for, or like it was out of reach. You know, that's a lot of time. It's a more expensive program. So we at the center wanted to provide more options. So you'll see we have a lot of different online education offerings because we're looking to, our mission is to reach as many healthcare professionals as possible to help join the movement and make change and ultimately make a positive impact on healthcare in this country. But November 20th, we're going to have another alumni panel. It's interprofessional, and we will have a nurse practitioner on that panel. But we also, please reach out. I know that was a private message, so you can reach out to, you can see the admissions email on Leah's Zoom right there, or you can message me again with your email, and we'll make sure to find out like where you are and find a nurse practitioner who might be closer in your location that you could talk to, who went through our program. And then, okay, 10 hours a week, real time online or on a regular schedule. So, and Leah, thank you for posting, and I can share this and we can look through it online, but the document in the chat is a PDF that gives you a full overview of the topics of the scheduling. It's not super granular detail. It's not showing you like this has 5 modules and it's this long. You do get that when you're part of the program. It is 10 hours, but it's not what we call synchronous. So the only synchronous times are when we have those faculty healing talks, and that's all scheduled out, and you can see the dates and the times. Those are going to happen. They're Thursdays, noon Arizona time. The thing that I like to emphasize though is that every week, like I think Omira was talking about this, the syllabus that's provided, it's going to say this week you need to do these modules in this course. Now you could do them early in the morning, 5 days a week. You could do them Saturday and Sunday. You know, you might, well, I'm off Thursday, you work 3, 12-hour days. You're going to do it on a couple of days that you want to work. It doesn't matter, like, so that like the real time, but we need you to be on pace every week. So this week you're going to accomplish this. You figure out that week what's the best way for you to accomplish that, except for the welcome, and you'll see that in the handout where the welcome session is a little bit longer. So I think maybe 2.5 hours, because we want enough time for everybody to get introduced and to get a full orientation of the program. But then the self-care teams, the faculty mentor will reach out to the team members, and you guys end up scheduling what works best for most people on the team to meet up. And then I think 60% of those you need to attend. So we also understand that it might not always work or something comes up, and that's okay, but we want you to attend most of them. What else do we have? Does the program offer handouts or aids for clients? Totally. So one of the cool things we have is called a handout library. And so even though like when you're in your nutrition course and hey, maybe this is a handout around elimination diets or AI diets, or a handout on sleep hygiene that you're finding while you're going through the coursework, you can also just jump over to the handout library from your class page, and you can download the PDFs while you're a student. And then later, if you join Premium Alumni, you can download those and brand the bottom with your practice information. So it'll be branded from the Andrew Weil Center, but at the bottom, you can have your practice info. So yeah, we have over 80 of handouts like that. Okay, cool. So get that out. Oh, yes. In the chat, Leah, you did that. Great. Okay, so Leah's so you'll see her email on her Zoom box is the old email, and it looks like this is new email. Hopefully, like someone's still looking at the other one if it has, but use this one, admissions@awesome. So that's how we pronounce it at the Andrew Weil Center for Integrative Medicine. We're awesome. And that's the email. So usually at the end of the session, or probably tomorrow, because it's kind of towards the end of the day here, admissions will get an email out to everyone who registered with, we provide an application fee waiver. So thank you for attending. We will give you a special code, and I can pop that up on the screen too, but thank you. It's in the chat, QA1024. So if you apply for this upcoming class that starts in January, use that code and you won't have to pay an application fee. I will encourage you, we just extended our scholarship application period to October 30th. You can't apply for a scholarship if you don't apply to IHeLp and get accepted. So if that is something that is a factor for you, please get your application in the next, I would say 10 days. So we can get it approved with you in time to get your scholarship SAN. Otherwise, you can apply into December and possibly even early January, because we've rescheduled it to the start time is January 20th. So again, please look at the overview with the dates to make sure those dates could work for you. And if you have any issues or questions about the timeline, do reach out. You can reach out to Leah at admissions, but she knows how to find me and right down the hall. So, and we really would love to connect you with other alumni if they're professions that weren't represented today, or hopefully you'll also join us for our November 20th panel, which will be fun. Just it's always exciting for me to get to see students that I just got to see you guys. It wasn't that long ago, but and hear hear how you're doing and know how the program has impacted you all. And I hope you know that we're here to support our alumni as well as our new students. So is there anything else that the three of you would like to share before we sign off?
I'd just like to say it was like one of the best gifts I ever gave myself, was taking this program. And I truly mean that. It's very well organized. I mean, Andrew Weil is like the godfather of integrative medicine. And when I looked at all the other programs, this one just shined on its own as the best program. And I thoroughly enjoyed it. So if you guys move forward and get accepted and do the program, it's great time to start. It's, you do it through the winter and then you're done, you're in the summer. And I decided afterwards to take this time to kind of soak in more of that information, because there's so much, and kind of practice a lot of the stuff that I learned. And it's just a wonderful thing to do in your career and for yourself and your loved ones. So, yeah.
I just want to grab the just so you all have it. This is the direct link from our website that'll give you some basic info. And it was just really great to see you all and talk. So thank you so much. I hope you have a wonderful Wednesday.
Bye, everyone. Take care.
Bye. Thank you.
Bye, everyone.
Bye.